And that's, of course, the paradox is how do we use technology to enhance humanity?
It's pretty safe to say that physicians feel like they've been burned by EHRs and the way that's changed the way they work every day, the way they interact with patients or don't interact with patients. So do you think there's going to be a hesitation to kind of look at some of these new tools, AI-based tools that are starting to come out now?
Yeah, there is no question. But the real issue here is that we have the most extraordinary problem with burnout and depression, even suicides among clinicians of all types. A large part of that is because of the feeling that they become data clerks and they're so burdened with administrative work. And that just led to this terrible erosion of the patient-doctor relationship. Well, when you think about that we could have keyboard liberation just using natural language processing, and that there's more than 20 companies right now that are on it and testing it in various clinics around the country. So it won't be long before that really takes hold.
You write in your book the idea that a patient's conversation with a doctor could be recorded, transcribed, and then both the patient and doctor can go in and edit the notes, which I thought was really interesting. Do patients want this? Do doctors want this? Do they want their patients coming in and adding information?
Yeah, well, there's a lot of resistance because medicine is so paternalistic. And so even though it's been proven by multiple studies that both doctors and patients are much more satisfied when they have the notes of a visit and that they have the ability to edit their notes. So we have to overcome this resistance. Any person who's reviewed their medical record will see they're on medicines that they're not taking and they have diagnoses that they don't have. And, we have to get over this because the patient knows what's going on and should have a right to edit it.
You did some work last year with the UK's National Health Service, kind of looking at the idea of a digital workforce. What do you think the U.S. could learn from what's going on with the NHS right now?
Yeah, well, I learned a lot, and the U.S. could learn a lot. So they have gotten rid of keyboards in a big emergency room, and it's showing to be exceptionally popular. But beyond that, what we learned is that the change in the workforce, because it does affect every single type of clinician, getting prepared for that. And one of the other advantages they have is they have a big education wing so that their education and retraining of the workforce. We don't have anything like that here in the U.S. The other thing we don't have is a strategy. We have no planning, we have no resources, we have no strategy in this country. So we could learn a lot from what the UK has done. Interestingly, the NHS, which I didn't know, is the most revered institution in the country, above the BBC and the royal family. So it has this egalitarian approach, and even when they have 1/3 of the cost per person in the UK for healthcare, they have better outcomes, and they are striving for even better outcomes at lower cost.
Stepping aside, so I reached out to some people on LinkedIn and heard from a medical student, Saeed Kaleem, who's talking about he's getting ready to pick a specialty. So he's kind of curious how you think AI and new tech is going to impact specialties.
So we're going to see every different area of medicine have a change. And the ones that are the information specialists, like pathologists, to some extent dermatologists, where there's very much a pattern and it's going to be bolstered by algorithmic interpretation. So here's the biggest issue, though, is if we can get this productivity and efficiency, a workflow at these levels that are unprecedented, is that going to be used by administrators to do more? To see more scans and slides and skin lesions and see more patients?
Make more money.
Or are we going to flip this and say, no, we're standing up for patients and we're not going to let that happen again? In fact, we're going to spend time and we're going to see less patients because we have this augmented power. So that latter requires major activism, and that's something that I know is going to be not only necessary, but are we going to be able to stand up? I mean, only recently have we started to see doctors stand up to forces like the NRA, stay in your lane and kind of fight back. But can they fight back this? Because this could make things even worse. We could have even, more burnout and depression. And here's the greatest opportunity we'll probably ever see to turn this back.
So who do you think should be leading this in a hospital?
Yeah, well, that's a fantastic question, because if we let the administrators of health systems and hospitals and clinics rule the roost, we're in big trouble. It has to be a clinical-minded person who understands that the relationship of patients and clinicians has gone south. And this is the way we can bring it back and get the care back. And so if we have people who are grounded in patient care and know what it takes, and it isn't done in 7 minutes with a keyboard, with no eye contact, and all the other things that are just unacceptable. If we use this and demand what's right for patients. So it also could be a grassroots campaign among patients where they say, I'm not going to put up with the current system because it's really depersonalizing. And that's, of course, the paradox is, how do we use technology to enhance humanity? This is our chance.